It's like an energy plant that is situated in every single cell. It's just not producing enough energy for what we need. So we're feeling more and more lethargic, we're feeling tired. And after the age of 40, we're definitely feeling tired, especially in the afternoon. Sometimes I need to stop on the side of the road in my car, make sure that I close my eyes, especially after lunch, because the energy is not like it used to be buzzing. I always was a buzz and a wheeze and could do a million things, and it's just not going to be always the same. And we know this, it's absolutely natural. So what the Healite is so amazing about, like why is it working so well? Because you can combine it with any other technology and a procedure that is quite invasive. And if you want rapid healing, rapid regeneration, rapid rejuvenation, and you want to work through induction, not destruction. We're not creating any wound or any burn. We're delivering enough energy per each and every square centimeter of human skin to get a better healing response. And it's nothing else but rejuvenation. Yes? So we've got enough LEDs connected in a circuit that you'll have enough energy per each and every square centimeter of the area that you're irradiating. So what I'm about to say is quite important. When you are performing a treatment for the face, you will only irradiate face once. There's no point of delivering irradiation onto the same area twice, because the cellular capacity is very particular and it won't take any more energy than it's able to store. It's a little bit like with mobile phone that is getting older. At the beginning, your mobile phone and the battery, when you're charging it, will last for almost 1.5, sometimes 2 days. And as the phone is getting older, it's the same with human body, that energy is utilized much faster and your battery doesn't have the same capacity for recharge. Yeah? We also need to irradiate quite frequently. So we are doing course of treatments. One will never be enough, because what your cells will absorb, they will utilize to repair, close the wound, produce additional dermal proteins, yes, deal with inflammation, regulate lymphatic flow, bring the circulation and oxygen and nutrients into the area, yes, yeah. It would be lasting for about 48 to 72 hours maximum. And then you need to come back and do it again. And the reason why is because we never stop aging. We will be aging until the final day. Yes? Wonderful. Yes. So this is why we always suggest a course, because what you delivered in form of energy to all those cells that were irradiated, within 2-3 days it would be utilized. So you need to come back and do it again. And after doing it a few times, you will get a peak in the cellular response and performance. Yeah, but it doesn't mean that you should stop in the middle of the course. It means you should continue to do at least 12. Okay, so we will talk about it because it's all written in here. I just wanted to let you know that this is why it's a very good idea to introduce LEDs with any procedure that you're finding invasive or resurfacing or opening or wounding or physical wound or chemical wound, whatever your wounding medium is. The LED will stimulate naturally occurring regeneration and repair process of the skin. And I want you to write down in the brackets, induction. Okay, it's happening through induction. We're delivering enough energy per each and every square centimeter of human skin to induce natural wound healing. Yes? So when we are young and we are babies and we'll hurt ourselves or create an open wound, when we're healing, the quality of the collagen that is being laid down is so good that later on in life you can hardly see that scar from the childhood. But as we're getting older, it's quite not the same. So also what the scientists have observed, Dr. Calderhead especially, there are very interesting new papers in your Dropbox, is that it's also reducing possibility of scarring. If you've got stitches and if you know that you're going to be surgically augmenting, reducing, altering the appearance, it's good to start irradiating them before the surgical procedure even starts, to prepare and deliver enough energy that when you're finally ready to cut or inject, the cells already know what to do. Yeah? And that way your substance, your filler, your injectable, also the invasion will be easily addressed by surrounding tissue. Yeah? So we also have noticed that our clients have got less pigmentation, less inflammation, less swelling, less scarring. They heal so fast, and also less bruising. Yeah? Wonderful.
Cool.
Is this making sense?
It's age 30. Yeah,
Yes.
you're talking about.
For most of the procedures for rejuvenation, if you're dealing with someone 40 plus, 830 would be the one. And I'll explain why in a moment. Okay, so Helite 2 will improve hyperpigmentation. Yes, because hyperpigmentation is forming when the skin doesn't deal well with inflammation. And your 830 is the most anti-inflammatory wavelength. Redness, acne problems, yes, 830 will also address some of the acne problems like dead bacterial bodies, toxicity, flushing through the lymphatic, bringing the circulation with oxygen, so on. But if you want to kill bacterial population, you will need blue light. And we're not there yet. We will be one day, but I'm sure that you've got other treatments for acne that you could combine with 830. And one day, if you report to me, Joanna, we're starting to have a lot of acne clients, then we can probably look at blue as well. But for the moment, I'm letting you know, if you're peeling them, if you're doing it, photodynamic therapy as well works really well on acne clients.
Okay.
Yeah. If you're peeling, if you're doing treatments with niacinamides or peptides, or you could also use 830 very, very well. Okay, so hyperpigmentation, redness, acne problem, reduce the signs caused by the skin aging process, okay? And the process through which your light emitting diodes work is called photobiostimulation. So your cells, I want you to circle that term, because photobiostimulation stimulation is the way how your cells are absorbing the energy through the cellular membrane or inner cell or both, yes, which we'll talk about in a moment, and you're increasing cellular performance no matter what the cell is, and you happen to have two wavelengths, one that is going a bit more shallow, which is 633, red, and 830 goes all the way to the bone and nerve and cartilage. Yes? So you can choose which wavelength you want to be operating with depending on the area that you're finding the damage or the issue or the challenge is that we're addressing. Yeah? Okay. So, problems that are caused by natural aging process. Photobiostimulation is an excellent way to increase collagen production. So if we want to work on fibroblast, which is located in the dermal layer, you will work with 633.
It's red.
Red. If you want to stimulate myofibroblast, which is located in the hypodermis, you'll go with 830. And it's nothing wrong with alternating your lights and each appointment using different one.
Can you deposit the same appointment?
No.
It's not?
No, because again, the cells will only take,
Not as
and
much.
if you will do one wavelength and then another, the photoreceptors will respond differently to each wavelength, so you'll confuse completely the cells.
Okay.
They wouldn't know what to do.
Okay.
So we always suggest 48 hours in between them.
Okay.
6:30 free, 8:30, or start with 8:30 because you want to give them a bit of a lift, and 6:30 free for the dermal activity. Yeah. I also like to throw in 6:30 free for someone that want to see the result in the mirror very quickly, because with 8:30, when you're going deeper, you're first of all creating those changes here. Yes, you're passing through the epidermis, dermis. There is some residual action, which is wonderful. But if you want them to go, wow, 6:33 is the one that energy deposition is in a more sort of a shallow area of dermis, and they can see it in the mirror much faster.
Yeah.
So if you want that, and here, and here, phenomenal. Combination of both is very, very good. You just don't do them on the same day. You're doing Monday with 8:30, Wednesday with 6:33, Friday with 8:30, and again Monday you can do again your 6:33 until you reach course of 12. Yeah?
Okay.
Lovely. All right. Collagen production in the skin, keeping it younger and healthier looking longer. One more really important point is that after around 30, 35, if we're really lucky, we stop produce collagen type 1, which is also known as neocollagen. So that's the beautiful soluble collagen that we produce in the ribbons that is helping to keep the firmness of the mattress in tick. After a certain age, we stop producing type 1. We only need to produce type 3, which is much more of a lower quality. It's not as soluble, it clumps together and cross-links, and the sugar attachment to the fibers is much easier. Yeah, it's not the same quality, not the same quality. It's not a juvenile collagen anymore. Now, the interesting fact that was observed by Dr. Calderhead and his colleagues on many, many occasions is that when you're delivering enough energy for the cells to feel like, oh my God, I've got the same amount of energy that I used to, automatically we're starting again producing type 1. That is the only modality that is able to do that for you. We have not seen anything working that way before. So you are growing your own collagen, and with every appointment, and the reason why I said please make sure that you'll get them through the course, because that soluble neocollagen type 1 will be produced by fibroblast around appointment 4 to 5. Every other cellular formation will respond much faster. The fibroblast and myofibroblast will need a little bit more time to present you with the peak of production. Why do you think is that?
Takes time.
Yes, and it's aging accumulation. We're not young anymore. If we're delivering enough energy, but there is also no wound, no opening, no physical aggression. So fibroblast and myofibroblast, they're really confused. They don't understand what's going on. There's no wound, but the skin is buzzing. There is so much energy, and energy is only sent to the wound when there's a real wound, because it is achieved by bloodstream coming to the area with the oxygen that is responsible for energy production. So only when you really open your skin, every cellular formation underneath is alarmed to close the wound very quickly. So this is why if you perform a lot of procedures that do create a wound on the surface, you get a rejuvenating outcome. The beauty of Healite is there is no wound, but the skin thinks that it's wounded, because all of a sudden we've got moisture factors coming in. Yeah, bloodstream coming in, oxygen, saturation, nutrients delivery, lymphatic is starting to pump again. because it's energized properly. Yeah. Lymphatic system, the lymphatic vessels, they don't have heart like our blood circulation, so they don't pump really well unless we are very physically active. Yes. And again, the lymphatic flow is more and more shallow with every passing year. So it is an amazing piece of equipment that if you have decided, I want to wound them to get a very good response, and if I'll put the Healite after the protocol, you're actually getting the double whammy. Interesting? Okay, so combination of two different therapies, no matter what your wounding medium is that you're performing first, Healite goes after. And we need to make sure that there is absolutely nothing on the skin that will reflect the light, because the light needs to be absorbed. So we will cleanse, we will exfoliate, or we will cleanse and tone, but we need to make sure that there is absolutely no oil particles on the skin. So it's very important that you will remove their makeup very well. So there's nothing on the skin. So the photoreceptors can absorb the energy and the light can be absorbed, not reflected. Yes? Beautiful. Okay. And the results will occur gradually during treatment series, an average of 10 to 12 treatments, and the number may vary depending upon the severity of the problem. And we ask them to initial here. If you're dealing with someone younger who is before 35, 40, well, depends on the skin age. Biological age is only an indication that I'm giving to you. In Australia, you will see a lot of customers with really aged skin, and they're not really there yet when it comes to biological age. They could be young, they could be 20, 30, but the skin is looking and behaving like it's 40, 50. It's very possible, and it's the damage accumulation from the sun mainly. Smoking and other things that they do as they do. Yes. So 10, I usually don't talk about 10 unless it's someone really young. 12 is what I usually recommend to all of the customers, and it is a course that is important to be performed at once. So 10 to 12 treatments. The number may vary depending on the severity of the problem. If you've got an immunity weakness, and we'll talk about those programs, you'll be dealing, let's say, with psoriasis, eczema, dermatitis, you can treat them with 830. The program will be slightly different, and this is why we're asking them to initial, because you'll be following different steps, and it's not 12 anymore, because it is a immunity weakness that if it's not treated properly can come back. Yeah. Due to the nature of LED light, photosensitizing medication as well as illness can cause photosensitivity. They are considered contraindication to the treatment. Okay, so who cannot have LED treatment? Someone who is suffering from porphyria, which is allergy to light. So if we're using LED light emitting diodes, of course they won't be able to have a treatment if they suffer from porphyria, or they're taking currently a course of photosensitizing medication, because they will automatically have the same symptoms as porphyria. And we'll talk about porphyria in a moment. Okay, so we need to know, and you'll see that on the contraindications, I've got the list of medication in a moment. So advise the therapist of any medication that you might be taking and of your medical history. So let's have a look at this list on the second page. So we're saying photosensitizing medication are contraindication to Healite. Yes, contraindication to Healite. Treatments. Below is a list of medication which can cause photosensitivity. Please mark any medication that you currently take. Please note this information is guide only, and there may be more medications that are photosensitizing. If you have any queries, please confirm with your doctors. Most of the medications which are photosensitizers will have that listed on the label of the medication. Okay. So what we have done is we've listed generic name and the brand product, because Dr. Larissa might prescribe brand product. But they will go to a pharmacy and almost automatically these days they are offered
Substitute.
pharmacy brand. Yes? So generic is the name of amiodarone, is the generic name for Codaron X. Yes? So we're giving you two names so your customer will also be able to recognize which one they're taking. And if they tick any of those medications, some of them are for heart problems, some of them are for infections, some of them are for fungal mycotic infection as well. Some of them are for epilepsy. So it doesn't matter. You don't really have to know exactly what the medicine is for. You're just interested in what they're taking, and we know that these are definitely the ones that are giving us grief. So how porphyria will display? Your customer will say almost automatically, I'm feeling dizzy and I'm feeling nauseous. Yeah, to the point that they develop really bad migraine and they might just start vomiting. So you really don't want them to feel this way, because they will never come back for treatment. So it's important that we'll find out before. Some clients are not on medication, but they could be slightly porphyriac and they have never been diagnosed with it. You will know as soon as you finish the treatment. They might go home and say, I've got a really bad headache. But you can also ask additional questions to find out exactly what happened. If they have been on medication that is not listed here, and they're taking, let's say, St. John's wort, which is a natural remedy for depression, and it's actually a photosensitizer, they could have the same symptoms. Yeah. They might not necessarily be diagnosed with porphyria yet, but if you ask them, how are you feeling during summer? Are you okay with sunlight? Are you okay with artificial light? And they would say, no, I'm wearing sunglasses all the time. And I'd like to stay indoors in the darkened room. These are the classic symptoms of porphyria. Okay?
Yep.
Yeah, but the chances are maybe no one has ever told them. So other products that can cause photosensitivity surfacely on the skin, or if they are ingested, like lavender oil or lavandula, that is prescribed often by naturopath doctor to reduce anxiety and stress. That could be photosensitizing too. And also those essential oils, when they are found on the skin, this is why we're cleansing the skin really, really well, and we ask them not to use a high concentration of essential oils, especially lavender, citrus oils, lime and sandalwood or bergamot. Coal tar and also perfumes, we ask them not to spray any perfumes on the area of irradiation. Sometimes they buy really perfumed lotions and potions in the pharmacy, and they've got often a synthetic fragrance as well. That's not ideal too. So we need to sort of find out what kind of skincare they're using. Soaps and shampoos with coal tar, we will just ask them not to use it that very morning before the light application. Okay. Some preservatives in sunscreen, which we're very lucky to say that they're usually used in the cheap and nasty sunscreens in the big bottles when you buy for $8 a huge 2 liters bottle. Of course, they need to use lots of preservatives in it, and the 6-acetoxy 2,4-dimethyl M-dioxane is one of them, and it's actually a photosensitizer. Quite interesting. Musk ambrette, which is often used in perfumes, and natural coumarins and crushed leafy parts of plants and grass and parsley and so on. So it's important to know what are they using daily. Are they using any remedies that they made themselves at home? Yeah. So, photosensitivity denotes a reaction to normally harmless amount of visible or near infrared light. Note that depending on the wavelength selected, He-light 2 delivers energy in the visible waveband. So, visible light is in the visible light spectrum that human eye can detect. So, 415 is blue, which you don't have. And 633 is red, that you definitely do have. So the 633 LEDs are calibrated exactly to emit 633 nanometers, which is pure red light. Okay? It's almost like a radio station that you have to have them calibrated exactly. That's what Lutronic is manufacturing in their own manufacturing plants, because another thing you need to know, that none of the parts in Lutronic devices are ever manufactured in China, not even half of the parties. They manufacture every little part themselves and assemble the devices themselves. Yes, so 633 is calibrated exactly to pure red light to stimulate the dermal cavity. Near infrared, okay, so 830, in fact, you don't see the color of 830 because human eye is not sensitive enough to see outside of visible light spectrum. And this is why Dr. Calderhead very cleverly have combined it with 590 nanometers. That is the only wavelength that you see initially. And then it's very, very shallow. It only stimulates marker cells to say something is about to happen. There's absolutely no clinical results from it. But when 830 comes in, you're starting to feel warmth because 830 really is the one that gives you a penetration of energy through epidermis, dermis, and hypodermis, and wipes away completely 590. What it is still left is the color that your customer can see. And that's important for psychosomatic effect, so they don't feel like, oh, I don't know, I can't see any lights. Is it working? Not working? What's going on? So that's why, in fact, it's not a yellow light. It's invisible, near infrared, with no UV component. So there's absolutely no UV danger in our device at all. Photosensitivity can be also caused by certain perfumes or plant materials like St. John's wort, which have been in contact with the skin or ingested. Metabolic disorder, I always ask for St. John's wort, because especially in winter. Because in winter, a lot of people in Melbourne suffer from SAD disorder, and they often go to Coles, and now Coles is selling all those herbal remedies, including St. John's wort, and they take some drops orally, so I always ask them. Metabolic disorders as porphyria and other light-induced rashes. Because porphyria also, if you're dealing with true porphyria, you often will see red rash. So all the symptoms that I told you about, plus a possibility of red rash. Yeah. Porphyria is a severe light-induced allergy and treatment is not recommended. So if your client is feeling maybe a little bit dizzy, doesn't have headache, but you see red rash, that's porphyria too. Okay. So a treatment is not recommended for them. Autoimmune disease like self-allergy, such as lupus erythematosus. Lupus erythematosus is the particular one that we don't treat our patients with He-light. And also albinism, because those albino cells don't really have the photoreceptors that are responsible for absorption of light. Yeah, so it wouldn't make any sense to irradiate them. Let's just go back to our page number 1. How are we going? Am I communicating
Excellent.
everything clearly? Yes,
you.
not difficult?
No.
Great. Okay, so we've done the medication. The light used during Healite treatment is similar to natural daylight and cannot cause any allergic reactions unless you are on a photosensitizing medication. Some skins may be experiencing momentary redness following the treatment. Why do you think is that? Because we've just delivered enough energy of light has been delivered into the cells, and you got a cellular response. But also what you got is bloodstream rush into the area, and moisture factors like your proteoglycans, like your hyaluronic, glycosaminoglycans, and you're starting to look like a little water balloon. That's what we want. And a little bit of that flushness, because you've got the blood coming in and flowing through the vessels, really supplementing all the cells in the area, and you will be feeling that slight warmth for a couple of hours. And the cells will gradually use that energy. So this is nothing dangerous, it's actually very, very normal. Okay. Momentary redness following the treatment, I want them to sign to initial to make sure that they understand this is normal and okay. Actually, very good response. Individuals prone to dizziness might experience some discomfort. What they're saying here is they're talking about locomotion sickness. Motion sickness. If you've got a patient that is suffering from that condition, they might feel dizzy. It's very easy to look after them. You just need to give them a glass of water with a slice of lemon or ginger and sit them up, and they'll be absolutely fine within 5 minutes. The interesting fact is that the more often they see the light, the better their locomotion sickness is. They actually not troubled as much.
Wow.
Quite interesting. It's the same with vertigo.
Okay.
We had quite a lot of patients which have developed vertigo during their life. Very often they are females after giving birth. In fact, my colleague Kylie, her sister, that's exactly what happened to her, and she was in hospital and really suffered, and we took Healite to her house, and we did a couple of courses, not one, until she was better. And the medication that she's taking now compared to what it was, it's very rarely. She's still taking it, but it's a much smaller dosage, and she is not really declining anymore. She's improving. She's having a normal 8:30 back of the neck for the pituitary gland.
Excellent.
So this is good to know, because you might be coming in saying, okay, I want to irradiate the face. Yes, on the face you've got the most amount of photoreceptors, so it's the best area for irradiation. But if I want to do face, I want to do chest, I want to do a knee because they just had a knee replacement, or carpal tunnel, or lower back, and then I want to finish with pituitary gland, back of the neck. Amazing, because you're also stimulating hypothalamus. So it's good for pain receptors, it's good for relaxation. So it's very good for, days that you are feeling moody and teary and you're expecting your period, or you just broke up with your boyfriend, or you're having a really bad time in life. Excellent for that. It doesn't have to be the only face area. You can do face and finish with the neck. Excellent. Why not? So the point is to irradiate different locations. It's fine, just not the same location twice, because the cellular capacity is only particular and only limited to the point that we can absorb the energy, and the rest will be wasted anyway. So double irradiation of the same area doesn't make any sense whatsoever. Okay, so individuals prone to dizziness may experience some discomfort, and these reactions are temporary and with no consequence. The results of any treatment depends upon the individual skin metabolism of each person, and this is why it's very difficult to predict how many treatments would I need. And this is why I'm saying usually it is 12 in the course, because each person will respond individually to the energy. If you've got someone who's got very slow metabolic ratio, you will need to wait longer for the results. If you've got someone who's got a really fast metabolic ratio, they'll be responding to the light much faster. And generally speaking, all younger clients will also respond much faster. Yeah? Okay. So this is why it is important to understand that speed at which results are achieved, as well as the final outcome, can never be exactly predicted. If they want a facelift, they really need to speak to Dr. Larissa about other options. Yes, but otherwise you can enhance and reduce the dramatic aging very much visibly. But you do need to create a momentum in your cellular network that you're irradiating to do their job better. Yeah? And it will last. All you need after finishing course of 12 is a top-up. How often would I do a top-up? One-off appointment once a month. So if they're coming for peeling, for needling, for facial, you just include the Helite into the regime, and it's excellent. It's like an add-on into the procedure. Yeah. The number of treatment sessions that will be needed will be estimated approximately and may change during the course of treatment series. Yeah. It is important that you attend scheduled appointments regularly in order to obtain the best possible results. There is no guarantee that achieved result will match the results that are desired. Okay, so if they want facelift, this is not a facelift, but it can definitely help. And with recovery, with swelling, with healing, with bruising, and also reduce significantly possibility for scarring. Lasting result will be so much better because you're not only lifted, but you're also encouraging the cells to behave like younger cells again. Yes? Some skin conditions are due to underlying problem, which if not resolved may cause the condition to reappear once the treatment series is completed. So in some cases, especially if you're treating immunity disorders, there is a different type of program which I will tell you about in a moment. And we no longer stick to 12. Furthermore, the skin aging is a natural process that cannot be stopped, although it may be slowed down, and that's exactly what we're doing. It is therefore strongly recommended to follow a maintenance program in order to maintain the best results. So in summer, I usually see them once a month. In winter, they come more often because there is less natural light. So very often your customers are feeling lethargic, they're feeling depressed, and they will come themselves asking, can I see the light every second week? And that's absolutely fine. Yeah, it's absolutely fine. So come and see the light whenever you feel like it. The first course of 12 needs to be performed religiously. But then for maintenance, you come and see us minimum once a month. But if you feel like you want to do it more often, you can. It's quite addictive and they often do. And I'm not saying no to them because it's making them feeling very wonderful again. Now also with a person that is aging quite dramatically and accumulated aging because of the biological age as well. If you've got someone younger, one course once a year, it's absolutely fine with some maintenance. If you've got someone older, you might decide I want to do one course after summer and one course after winter, when the skin most needs it, and maintenance in between. That's also fantastic. If you've got someone that wants no invasive procedures, but they want younger looking skin, you can do even 3 courses in a year. But what we recommend is about 4 months in between them. So you've delivered a lot of energy and we're allowing the skin to still work. Yeah, we ask you to continue to do the good job, and from time to time we will give you a top up, but it's not unusual. And you might also have a customer who will say, I cannot do courses. There's no way that I can come 3 times a week, yeah, or twice a week, because we say minimum it's twice a week. But in the week 1, if you could come Monday, Wednesday, Friday, on the next week you are very close to appointment 4 and 5, and you're starting your collagen peak. Yes? So if you can come in the week number 1 3 times, that's even better. If you cannot come any more often than twice a week, this is a bare minimum what we need from you to give you the best results. And sometimes you might have someone who says, I can't do that, I can only come once a week, but I want to come throughout the year. That's okay too. We won't have quite the same result. But if this is all that they can do, I'll show you how to do a slightly stronger treatment on them.
Yep.
And it's not like the cells will take double the amount of energy, they will probably take 5% extra. But instead of giving them 60 joules, you give them 80 joules, and the cell will take whatever it needs to take, and the rest will be rejected, obviously. Yeah? So there are ways of what should I do if my customer can only do 1 a week irradiation, but throughout the whole year, for example. Would they get exactly the same results? No. Yeah? That's still good results. Wonderful. I have read all the above explanation recommended regarding Healite 2 treatments. I understand the advantages and limitations of the treatment. I agree to follow the recommendations given to me by my therapist, esthetician, in order to achieve the best possible results. I understand that there are no guaranteed results, and the maintenance is necessary because we never stop aging. Okay?
Yep.
I want to also tell you that if you are treating someone with tissue necrosis, yes, open skin like ulcers, diabetic ulcers, freshly operated on injected skin on, you are in the city, and I know that from another account of mine that operates in the city, there is quite a few illegal people operating in the city that are injecting from the apartment, and when something goes wrong, they're not there next day. So Michelle had someone coming with a really unsuccessful filler on the nose, and that got really infected. When she wanted to go back and complain, they were no longer there. So she found Michelle. Michelle has got a Healite 830 immediately, and she pretty much have saved this lady's nose.
Exactly. Oh my God.
So it does help with necrotic tissue. It does help with grafts. If they're dying and they no longer, it's usually 633 that you will use for grafts.
Okay, superficial. Yeah.
Yes. Yeah, so there's so many applications. Yeah, 830 has got more versatile. 633 is really epidermal, dermal, that's it.
Okay.
830 has got much more of a scope of action, and this is why I said to Dr. Larissa, 830 is a must.
Yeah.
So myofibroblast that is located in the hypodermis, actually at the very end of each muscle, it's almost like a rubber band, and it's responsible, it's an intelligent collagen with hooks. It's responsible for the muscle attachment to the bone. That elastic band made out of myofibroblast is getting really loose as we're getting older, so you're starting to see laxity. If you are wanting to improve on the jawline and you want to lift the muscles because you are improving the quality of myofibroblast with 830, that's exactly what you do. So I like a combination of 830 and 633, very much so. 633 also would be very useful for hair loss and alopecia.
Yeah.
Yeah? All right, beautiful. So what I have done is you've received a pack of brochures. They are fantastic brochures because they've got pictures, before and afters and so on. But I also have designed something like this for you that you could print and give to your customer together with the brochure, that is explaining that this is a device that is offering faster healing, pain management and more. Low level light therapy, LLLT, that is a term that was coined by Dr. Glenn Calderhead. So that's exactly what LEDs are emitting. They're emitting low level light therapy. With Helite 2 is a therapeutic use of light emitting diodes to enhance your body's natural cellular recovery, improving healing times, relieving pain, subsiding active acne, promoting skin rejuvenation, and more. The pain-free, non-invasive treatment delivers concentrated energy deep into your tissue, affecting your body at the cellular level. So, 633 delivers more shallow. 633 also passes through the membrane of the cell and delivers straight to mitochondria and organelles. So the whole cell inside is buzzing. 830, surprise, surprise. The energy is first absorbed through the membrane of the cell, then irradiated into inner cell and bounces back to the membrane again.
Okay.
This is why it's working so well on psoriasis, eczema, dermatitis, all the conditions to do with compromised membrane.
Wow.
This is why we need both. Yes? Fantastic.
Excellent.
So, your physician can use Helite 2 as a standalone therapy or adjunctive enhancement of recovery with nearly any procedure, like LLLT is painless, non-invasive, risk-free, safe and effective for all skin types. It is also excellent for wound healing, pain relief, muscle and joint pain, arthritis, hair regrowth, skin rejuvenation, acne. Okay, so wound healing, both 830 and 633. All you need to think is how deep is the wound. Pain relief, which one? 830 is much better for pain relief. Muscle and joint pain, 830. Arthritis, 830. Hair regrowth, 633. Skin rejuvenation, it depends with exactly. And active acne, it's usually blue. But if we don't have blue, we want to work with 830 because 830 will be more anti-inflammatory and it will take care of the lymphatic collection of debris, of toxins and dead bacteria. Yeah. How would it work? The deep penetrating LED lights are soothing and they target deep into the skin cells to heighten the internal functions, photostimulate blood flow and induce faster healing, decreasing pain, reduce acne and more. So when you're actually looking at the healing time in comparison to someone who has been using 830 or no 830 have been offered, the difference is quite significant. So after facial surgery, without the Helite, it would be about 13 weeks of wound healing. With the Helite, it's only 6 weeks. Bruising, it usually is 1 week. With the Helite, it's only 2 days. So that's 78% of reduction. Even if you're dealing with really large hematomas, like post-hip replacement, and we've got approved, Dr. Calderhead himself has got 2 bionic hips, and he usually sneaks in Helite into the hospital, and they're all very impressed that he's recovering very, very well. And so he's always making a joke about himself being bionic man. One of his knees is also reconstructed now because he's in his late 70s now. So Erythema 15-16 weeks post-surgery and only 2 weeks, which is 87% of reduction if you have used Helite. Edema 5 days to 1 week, and if you use Helite it's only 2 to 3 days. How comfortable is the treatment? Very. In fact, many patients find it relaxing. How many treatments will I need? Your physician will discuss treatment goals with you, and the goals will determine the number of treatments that you will need. Typically, patients are treated twice a week, so 2 times a week, over a period of time, and many patients see and feel results just after 1 treatment, which is true. But I don't want to stop at 1 treatment. I want to continue a very good response. How long are the treatments? Relatively short, depending on the physician's treatment plan. Typically, treatments last between 10 and 20 minutes, depending on what we're doing, yes? How long is the downtime? There isn't any downtime from the standalone Helite 2 treatment. However, if the Helite 2 is an adjunctive treatment to another procedure, there may be an associated downtime to other procedures. Your physician will discuss this with you during the consultation. Do remember that a little bit of a swelling and erythema is absolutely normal. That's really good symptom to see. Yeah? All right, let's look at your programs now.
Yep.
Yes? Okay, I know you've been waiting. I kept you
So
waiting.
with PRP we can also do this together, like a PRP injections in joints or hair regrowth. We can probably combine as well.
Absolutely. Yes, absolutely. So if you're doing it for the joints, you'll be using 830.
Yes, of course, yeah.
If you're doing it for the hair, it would be 630.
Okay,
Yes.
excellent.
Amazing. Okay, so let's have a look. So you've got the indications, which are the conditions that you'll be treating your programs. Yes? 4, wound healing. So we've created a wound, or they created a wound. Let's say oh my God, my child was burned in the kitchen, which happens very often actually. You need to see the person, the child, whoever was burned, immediately under the Helite. Which one will be more effective on the burn?
Superficial.
I would say 830, because with 633 the skin is already hot from the burn, and the deposition of the energy, that would be almost unbearable.
Yeah.
Post laser, also 830 is better because the skin is already hot on the surface. So
Okay.
immediately post 830.
Okay.
Yes, but a few days later you might introduce 633 when they're no longer hot and sensitive to touch. Yes, so wound healing. Hasten scars, burns, surgical improvement, post and after surgery, you will be using most of the time program 3 or 4. Program 4 is usually the most popular program. You'll be always using 60 joules, and you'll be performing a treatment immediately after, and then 2 days after, and then twice a week for 2 to 4 weeks, 2 to 3 days apart, until you reach the course of 12. Yes? What they also say is 1 session recommended on a day before the procedure to boost the healing and repair. Okay, I usually say I'd like to do 3 appointments if I know that my customer is going to be undergoing facial lifting or any surgical, blepharoplasty, augmentation, reduction, bust. I want to make sure that I'm using my 830 at least 2 times before, and the 3rd time immediately before the procedure. If you don't have Helite in a theater, just do 3 times before, then allow for the surgery, and then ask them to come back within week number 1.
Okay.
So they could continue the course of 12. Yeah? Yeah? Beautiful. Some doctors, if they do have Helite in the theater, like let's say Dr. Rubinstein, often irradiates just before and immediately post. So the stitches are done 8:30.
So 2 procedures the same day,
Yes.
before and after. Okay.
Yes, that's what he does. 8:30 is the only one, because the energy is distributed evenly, that if you need to do it day by day for no longer than 3 times, that's quite possible. So when you're treating, let's say, Collingwood Football Club, that they actually purchase the Healite because their return to play is so much pressure. So if we're dealing with skeletal-muscular injury, Dr. Calderhead suggests to do 8:30 Monday, Tuesday, Wednesday, and then go back to 48-72 hours. That's the only time that your injury is deep, and you could use 8:30 3 times in a row. That's without amazing. Separating it. Yeah? Okay, beautiful. Otherwise, stick to the protocol here. Yeah? But what we can improve on is more sessions before. Post-care, after laser treatment or chemical peel. Okay, because we've done, let's say, traumatic peeling, we've done something, let's say TCA peel, that is quite a full-on. There's quite a bit of epidermolysis, and you want to deliver your energy a little bit less joules per minute, so your program will be longer. Okay, I'll explain. If you come to the very bottom of the page and you're seeing that each program is 60 joules, yes? So I want you to land your finger on 60 joules here and go this way, and you will see your programs. Program number 4 delivers 60 joules in 13.5 minutes. So there is a lot of joules per minute. Program number 3 delivers the same 60 joules in 16 minutes. So there is a little bit less joules per minute, but the effect is the same, yes? Level 2, program number 2 delivers 60 joules in 21 minutes. And finally, level 1, that is hardly ever used, unless I've got someone who's been severely traumatized, operated on, have spent a couple of months in the hospital, and they are generally speaking in very poor condition. I could decide I want to do 60 joules on program 1, but just remember it would be almost half an hour. Yeah?
Exactly.
Yeah? So if you've got laser, chemical peel, or something really hot or traumatic, that you've got a bit of trauma in the surface, you will lower your intensity, which is the program, to a little bit longer program. So you'll deliver your 60 joules less aggressively. And again, you'll do it immediately after, okay? 2 days after, and twice a week for 2 to 4 weeks, 2 to 3 days apart until you reach 12. Skin rejuvenation, for skin rejuvenation, again, program 3 and 4 on 60. Now, pain attenuation, and we've got here acute pain, chronic pain, yeah, post-operative pain, musculoskeletal pain, and neurogenic pain. It's usually program 4 on 60. And if we're dealing with acute, which is sharp, now something that just started, we are going to irradiate with 8:30 every other day, so every second day, for 1 to 2 weeks. Then 1 a week until better, so it's no longer 12. We will go every second day, 8:30, and then 1 a week until better. If you're dealing with chronic, you will go 3 times a week for 2 weeks, and then twice a week until better. So when you're dealing with psoriasis, you'll treat psoriasis, you will treat like an chronic.
Yeah.
3 times a week, and then twice a week until better. So you're no longer following 12, and they need to understand why. because it is a condition that if it's not treated properly and long enough, it will reappear. The results are phenomenal, I want to say.
Okay.
Okay, note. Please refer to the following table for the relationship between energy level, intensity, and treatment time. So intensity level 4 is usually recommended. Is that what Joanna said? Yes. But lowering it to 3 or 2 is permissible, depending on patient's reaction to the treatment. Note that lowering the intensity level for any given energy setting will automatically increase the irradiation time only. You're delivering still the same energy. Yeah? Thorough cleansing of the skin surface will aid penetration of light. So we want to make sure that there is nothing on the skin that will reflect the light. We want absorption, not reflection. Where possible, mild exfoliation or epidermal power peel will give optimum efficacy. Yeah? That's your 8:30. 6:33. Okay, so 6:33 is used for post-care after laser treatment, but not immediately after laser. Immediately after laser is 8:30. When the skin is no longer hurting or feeling burnt, you can introduce 6:33 for dermal stimulation. Yeah? Fluence will be 60 after, we usually say 24, 72 hours, and then twice a week for a total of 2 to 3 weeks again. Hair regrowth, what you're going to do is you're going to use 40 joules, not 60. And we'll go to program number 1. So, okay, 60 joules on program number 4 will be 20 minutes. So your red light program is always longer than 8:30 program. Yeah? But if you're doing hair regrowth, you only need 40 joules on level 1, which is 33 minutes and 20 seconds. Can you see that? And your device will calculate this automatically. You don't have to worry. Thank God we don't have to worry. So that table is laminated just in case if you are worried. You will always have it on your device just to check that I've got the right settings. But time, the device will calculate for you. So you don't have to worry. All right, then we've got the skin rejuvenation. Again, program 4 is recommended, especially if you do fibroblastic activity, if you do grafting, yes? If you want the graft to take on the circulation, not to die, you really want to feed it. Program 4, 60, twice a week, minimum, total of 4 weeks, yes? Photodynamic therapy. So photodynamic therapy you will do for 2 reasons. Either acne or non-melanoma skin cancer or rejuvenation as well. Because aminolevulinic acid is only absorbed by faulty cells, not by healthy cells. So you apply the photosensitizer first, aminolevulinic, under really dark dressing, or you leave your client in a really dark room, and then the dressing is removed, and the incubation time depends on the concentration of aminolevulinic. If it's 5 to 10%, you usually do 1 to 3 hours. For rejuvenation and acne, it's about 20 to 30 minutes maximum. Yeah. And then the photosensitizing ALA is removed until there's nothing on the skin. The skin is pad dry, so there's no reflection of water, and you're using 633. Yes? So the faulty cells that have absorbed, or the P. acne that have absorbed the photosensitizer, will be destroyed. And the skin will be powdering off. It's not really peeling, it's powdering off a few days later. Immediately post, you will feel hot and sun blasted, like you've just had a really bad UV burn. Yeah? Non-melanoma skin cancer, obviously the aminolevulinic 5-ALA will have to be at higher concentration, 20%. They're recommending 40 joules, and program number 4, and incubation with ALA initially in complete darkness will be between 2 and 6 hours. Yeah? If you follow those guidance, very successful. You usually need one treatment only.
After filler injections,
After
filler, we could do filler like 6
you can.
or
It depends how sensitive and what kind of filler. Or you can do 830. If you're going deeper with your filler, you can do 830. If you're going more shallow, 633. So just think about the area that you're going to be, because there's no heat with injectable. Yeah. So we're always targeting a muscle. Yes. If we're doing Botox, yes. So 830 better with the Botox.
Yeah.
Yeah.
It's just Botox will kind of be destroyed by this. No?
Yeah. So we're waiting a day before or day after.
Yeah.
While 633 will give you dermal stimulation, not so much of a muscle. Yes. So yes, 633 can be incorporated if you want that surface radiance and the Botox working in the muscle.
Underneath. Yeah.
Yeah. Yeah. What else? Anything else that we are? And again, the same theory. If you are wanting to deliver your 60 joules slower, you can go for program 3 or program 2 or program 1. Yes? Now, if you turn the next page, you've got a combination of what you can do if you've got both wavelengths, and you do. So 830 with a little bit of 590, which is yellow, and it gives the program its color, is great for traumatic wounds, surgical wounds, burn wounds, ulcers, okay, sports medicine, skin rejuvenation, pain attenuation, acute, chronic, post-operative, musculoskeletal, neurogenic. 633 is a great enhancer for your PDT, hair regrowth, alopecia and stress alopecia, and dermal rejuvenation. Yes. If you're combining them, you've got wound healing and skin rejuvenation on different levels. Above treatment settings are the general settings. We recommend adjust treatment values depending on each patient's individual needs, special circumstances, and treatment history. Lutronic shall not be liable for injuries, but we can't do any injuries with Healite unless you'll hit someone over the head with the light, which is not going to be possible very easily as well. This arm is very firm. I have seen LEDs before that were landing on the noses, but not this one. Yeah, which is wonderful. So it's a very good software and hardware all together. Yeah, wonderful. That's it. Let's